Good morning and welcome to the Agoria HealthTech webinar. Today our
Mhm.
subject is on the Health Data Agency. We are honored with our guest speaker, Sophie de Broe. Sophie de Broek was at Interim Director of Health Data Agency. She led the foundations on the metadata catalog, the website, the governance, the data request process, and the HDA Academy. Thank you for being with us today, Sophie.
Mhm.
We know that you are very busy. You are officially scientific director of Cienzano, and you took the work on HDA on top of it. Um, we are looking forward to your presentation. Before we start, we would like to go over some practical details. There is ample time for questions. Um, Sophie's presentation will consist out of two parts. So after each part, we will go into your questions. So you can put them in the chat or raise your hand at the time of Q&A. So don't hesitate to raise your questions. The floor is yours, Sophie.
Okay, thank you very much for inviting me. I just have to rectify one small thing. So I was previously at Cienzano as scientific coordinator. Then I was at interim, appointed for leading official at the HDA, Health Data Agency, and I did that full time until the 1st of April. And then I was made scientific director of data governance at Cienzano, and that's particular because it's a new scientific directorate. So Scienzano has now a sixth scientific directorate, which has to be built up from scratch. So that's quite a nice challenge. I will show you my slides. Um, okay, from the beginning. Can you see
Y-
in slideshow now
Yes,
from the beginning? Yeah, okay.
it's
So
perfect.
yeah, so, thanks. So, I will introduce to you the Health Data Agency. And I always start with a little anecdote. So, last year I received Spotify Wrapped sent to me, and it was full of beautiful visuals like my music taste. I listen 13 days a year to Spotify, and I am a kind of a vampire when it comes to my music taste. Now, I asked my husband, so how about your Spotify Wrapped? How did it look? And he didn't know what it was, but he just said, oh, whenever I listen to Spotify, I log into your account. So that means that none of those visuals were actually correctly reflecting me. They were also reflecting my husband's taste, and I should have known because I don't listen to Irish folk. And so I also apparently don't even listen 13 days a year. So I mean, that data is actually not quality data. It's probably very strong algorithms, but it's not transparent how the algorithms are made. It's not reusable. It's not. It's not of very high quality. It's not transparent. So I just thought this is not the kind of data we want for health data, of course. Now, why was the HTA created? Some context. So first, at the bottom, you see a lot of initiatives in the health data sector have been taken over the last, I would say, even 10 years. You have the health data platform, but you have many other initiatives more recently now, the Health Data Alliance in Flanders. So these, together with the top-down push from the European Health Data Space Directive, which looks at two things. The Health Data Space, the European Health Data Space Directive focuses on primary use, which is the purpose is to empower individuals through increased digital access and control over their electronic personal health data, and then also uh, im- to improve secondary use, so providing a consistent and trustworthy and efficient setup for the use of health data for research, innovation, and policy making. And the HDA, of course, benefits from being in between those two and push from bottom up from these initiatives that already existed, and top down, a very hard push from Europe to make progress on those two. However, the HTA will solely focus on secondary use. Um, why? Oh, Sorry, I get a phone call. Why creating the HDA? You will see that on the left-hand side, a lot of institutions have data, pharmacies, hospitals, doctors, research institutions. And on the right-hand side, you have a lot of potential people who are interested in this data. And the HDA, oh no, this person is very persistent. Um, so on the right-hand side, people who and institutions who are really interested in the data. And the HDA wants to be a facilitating, coordinating organization between the two. So to facilitate data access between the parties on the right and the data on the left. Um, through a data-driven healthcare system, and in order to be prepared for the digital era, like that is one of the strategic objectives of Europe. Now, the realities of today is we still have very slow approval processes, meaning it takes time to approve to get access to data, poor interoperability, so data can very poorly be linked because they're all different standards, or data findability, so you don't really know where sits which data. Access is a problem, lack of that data standardization, lack of clear privacy guidelines, poor data quality, and ultimately very little reuse of data. That's the reality. So what is the HDA? The HDA was set up by law on the 14th of March last year. And in the text of the law, it's always interesting to look at the law, actually. It's the first time in my life since I work that I have looked at the law text so often, because it really tells you what your mandate is. And so here we have three strategic domains: facilitate the accessibility of data, stimulating innovation and research, and development of a policy strategy. That's the big strategic domains of HDA, and I put them in French and Dutch because that's the law text that I take over. And the same for in the law, there are 14 tasks defined for the HDA. Reinforcing trust of citizens, building a metadata catalog, support reutilization of data, improving the quality of the data. And one of the things I put in bold there at the bottom is transparent data governance. And here, this is where a lot of work needs to be done, because data governance tells you who can access the data, under which mandate, under which conditions, what can be done with the data, how can it be published, how fast does it has to be published and make public, etc., etc. And all these things are really not in laid out in clear rules and regulations, and as a consequence, everybody does a bit their own thing, and that is the drama of the data governance in Belgium. Okay, so for setting up the HDA, we started with a program. This program consists of architecture and tooling, HDA governance. That means we had a steering committee around the HDA and a user committee. We had metadata content. We had communication and ecosystems that we are looked after. Then the legal ground was laid on the 14th of March. And then the content of a HDA Academy was provided. So this program consisted of me as at interim of leading official, and then the people from KPMG, so mainly consultants. And of course, the whole idea of 2024 is to move from a program with consultants to an organization with its own staff. So staff members appointed by the Volksgezondheid, the ministry, to ultimately then, of course, provide service delivery, research, and facilitate innovation. And I will tell you a little bit more how we see this. So what will the HDA do? And it's actually 5 big things. It will be a health data access body. It will provide access to metadata. It will facilitate verification or support verification. It will increase data literacy and communication, and it will answer your data requests. And I will explain all of these in detail, and you will find in the top right corner where we are in the snake, so you can follow at which point we are. So the first thing the HTA will do is to be a health data access body. What does this mean? The European health data space provides for a health data access body, and normally Europe had thought that they could have one health data access body per member state. So this member state would, this health data access body for this country would do everything, meaning facilitating coordination, governance, processing environment, data permits, the whole lot. Now, from the very beginning, the member state said, no, that's not possible because some of those responsibilities have already been allocated to certain or existing organizations. So now the setup is that there will be several health data access bodies for per member state. And each of those will have several roles, will have specific roles. So for the health data agency is a health data access body with a certain role. And so the roles it has are listed on the left. It has is a single point of contact for Europe. It will be a facilitating, coordinating organization, like I already mentioned. It will provide for governance, and it might provide also for a processing environment for synthetic data. Now, it will not, the Health Data Agency as a health data access body will not have the roles on the right, data permits. It will probably be given to the Information Veiligheidscomité, and a secure processing environment, not as yet. It might be, but it is not yet. So again, these health data access bodies, there will be several per country, and they will have specific roles allocated to them. Okay, very important part of governance is the ethical framework. So I'm still in the first loop of my five snake path because I elaborate a little bit on the first one. The other ones will be quicker. There's the ethical framework, and as I already said, for primary use, the focus is very much on the individual, the relationship with the clinician, and this very private information that is exchanged there, and this protection of this information. Whereas secondary use is really, really, really about the common good and the community. That's why the symbol is like that. And what I mean by that is, I'll explain a little bit more. Secondary use, what is this? Secondary use is the processing of health data for purposes different than the initial purposes for which the data were collected. So what do you want to achieve? You want to achieve to do research, and then this research serves again to improve the quality of life of patients and citizens. Now, in order to do the research, you either need an exhaustive an exhaustive register for the whole population, or you need a representative sample. The European health data space provides legally to opt out for patients. But of course, if patients opt out on a mass scale, there's a threat to research because you will not have a representative sample or you will not have a complete register. The philosophy or the standpoint of Health Data Agency is that involving patients from the very start, when you design your questions, your research questions, offers a lot of more opportunities so that people don't have to resort to opt out. You have to convince patients and involve patients to that extent that people trust that the research is being done for good purposes, so they don't have to opt out. And that's the whole idea behind involving patients throughout research. So then another important point, and legal framework. So we have our data subjects and our data custodians. Without the patients, there is no data. Without doctors, there is no interpretation of this data, so also no added knowledge. Legally, data ownership would imply the right to solely decide who can have, hold, destroy data. But European and Belgian legal framework does not recognize data ownership. So nobody is owning the data. It confirms the rights and obligations for several parties. So it's about rights and obligations. It's not about data ownership. And what do we mean by that? So for primary use of health data and secondary use of health data, the legal conditions and frameworks continue to exist, meaning for primary use, it's still health data as a common good. That's always behind the two. There is for the European health data space, member states may provide an opt-out for patients. For Belgium, that's already the case for primary use of their data, so the data that is used to treat them. But in general, of course, primary use data is very much based on informed consent. Patients give consent to using the data to treat them. But for Belgium, there is always this opt-out possibility. For secondary use, very recently, the European health data space landed, and it provided that member states may include an opt-out, an opt-in for specific data, meaning genetic apps data and biobank data, because there the data is nominative. There the data, the patients is still, you're still able to identify the patients. And so for this type of research, where it's nominative, the European health data space provides that member states can say, okay, patients have member states may go for an opt-in, meaning that they have to ask, that they have to provide in the law that patients are each time asked to participate in the research. That's of course a very demanding position, because you have to ask every single person. For secondary use, again, the European health data space provides, they say that the member state shall provide for an opt-out, so that patients can always opt out of the research, but it provides also exceptions to that, meaning for public health research, statistical purposes, or to do research for the common good. There can be exceptions to this opt-out, so that people have not the option to withdraw from the research if it's for these purposes. And in general, it is the principle of health data as a common good. And this is, of course, what the Health Data Agency hopes that will prevail in the discussions, so that we can talk about data solidarity, because health data saves lives, not only yours. And what do we mean by data solidarity? Is that people give their data into a common pool, like we all pay taxes in a common pool, so that the welfare state can sustain people who are ill or dependent. So the same idea behind data, you have data solidarity from the idea that we all give to the common pool our data, so that this can be used for improving our society. Good. This was a big chunk. Now I'm going to will the HDA do in the second instance. It will facilitate data access via metadata catalog. What does that mean? The Health Data Agency is not a data warehouse. So it's not sitting on top of a lot of data. It's rather a facilitating organization that will tell you where the data sits in which organization. So for doing that, it will inventorize the data sets that sit in RESIF, that sit in KCE, that sit in Cienzano, that sit in, so that once you know where they sit, they are documented. And so we will also provide support. The Health Data Agency will provide support to document the metadata, and finally provide for a tool to search in these data sets. And so far, the HDA, when I left, was documented 120 data sets, of course, because documentation takes a lot of time. What will the HDA also do? It will so facilitate verification. What does this mean? Verification, making data fair, means making data findable, accessible, interoperable, reusable. How? By providing guidelines, tools, governance, and coordination. Now, that all sounds very nice, but I give you a concrete example. What we did is we undertook a data maturity analysis of each of the founding organizations of the Health Data Agency. This is a systematic evaluation of an organization's existing data management and usage capabilities. And what you do is you look at 9 dimensions, there on the left, of data management governance. And under these dimensions, you have a very specific indicators. These are not mentioned here, but below data strategy, there is, for example, does your organization have a data strategy as one specific indicator? And when your data is immature, so undefined, it means that it has never thought about a data strategy before. If your organization is mature and consolidated, then it means your organization has a data strategy and it is published online. And From this exercise, you first establish the as is situation. What on which level of maturity do I have for this indicator? And then you decide on the level of maturity you want to reach in the future. And then between the two, you decide how to bridge the gap. And these levels of maturity are described in the tool. So you know exactly what to do to reach that maturity level. And so you say, look, okay, these descriptions match with my state at the moment for immaturity. So I go to the high maturity descriptions, like I need to have a data strategy. It needs to be published on my website. And that's exactly what we did at Cienzano. 2 years ago, we already did this tool. We already did this maturity analysis, and we followed all the steps that flew out of that exercise to mature to a higher level. That's a very nice way of defining your data strategy as an organization. So the results will be published, and anyone who would like to undertake a data maturity analysis is welcome to approach the HTA so we can guide you through this exercise. The HTA will also increase literacy. So we have a beautiful academy on the website. It's a learning platform. It's a knowledge center. It gives you leading practices. And it's a community bringing people together, of course. So it will give you a whole set of packages where you learn about ethical frameworks, the European health data space, what is a metadata catalog, how do you search for them on the metadata catalog for of the HTA, and the packages are growing. In function of what our users need in terms of extra information with regards to data management. And later, we will maybe also provide courses on perhaps artificial intelligence, but at the moment we are also focusing on existing material naturally. We will not reinvent the wheel, so we will also link up with other websites from other HDA organizations in other countries, so that material is being recycled across. So we are also communicating via our website on the right and the LinkedIn page on the left. And there's our QR code. So you may have seen us on LinkedIn. And then finally, the last thing we do is we answer your data requests. So we will support your requests. You can look up on the open data catalog, the data that is out there. You can search for the metadata in the catalog online with the HTA. We identify the data you may need. We also identify the missing data. And then you can hand in a request form, fill in it online. Then you fill in a more detailed request form in the second step. We go through a go, no go, and prioritization step. And then you receive feedback for the next steps to finally access the data, use the data for agreed purposes, dispose of the data, and have a happy requester. I said we will go through a no go, defined criteria for a go, no go, and that's not quite finished yet because it's not so straightforward. We are in a discussion with other stakeholders how they do it, because hospitals also have this kind of criteria listing. What do you use as criteria to define if somebody has access to data or not? And so you have to look at, does this party who's accessing the data has the authorization? How much time it takes to access the data, the degree of availability of the data, the goal of the research. So these are some of the criteria for a go, no go. Again, and it's not finished yet. We're talking to other parties who are dealing with similar issues. And then we have to prioritize in terms of the requests, who comes first, depending on the impact, the reusability, the data complexity, etc., and the type of requester. Okay, and finally, these are the people the organizations that sit on the steering committee of the Health Data Agency, to which I always express a great thanks for helping us to jump the hurdles over the last year and a half to reach a certain level of maturity with the Health Data Agency. And then, because I had a bit more time, I use this opportunity also to introduce to you the new scientific directorate, data governance at Cienzano. It's brand new from the 1st of April, so there was no scientific directorate data governance, and I have become scientific director at interim because I have to go through the procedure still.
Sophie,
Yeah,
could
yeah.
we just pause
Ask, yeah, yeah, yeah.
a
Ask
little bit?
questions. Ask questions. Yeah.
because it was very interesting
Yeah.
on the HDA.
Yeah.
Everything, almost everything, can be found on the website as well. This has been
Yes. Yeah.
finalized.
Yeah.
Uh, does anyone have a question? Feel free to speak up. You can raise your hand. So while we are waiting for questions, so any organization can come and to the Health Data Agency and asks for guidance on how to start with the data maturity analysis.
Yeah. 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 So we have a tool that you can use, and we can guide you through it if you want to do the exercise. Um, it's not difficult. I've done it with Cienzano 2 years ago. I used a slightly different tool, but it comes to the same. So you go through the indicators, but the only thing that is a bit challenging is to get your organization together. So you have to have these kind of working groups or um, people who are willing to spend time to think around what is the maturity of our organization for all these indicators. Now they have to have a discussion, and is level 1, 2, 3, and then it's the discussion, where do you want to go. But it's a very, very interesting, useful way of assessing your maturity as is now, and then where you want to go. And out of this you can then define a very nice data strategy. You know exactly what to do. So yeah, but you can talk to the HTA how to do this, and they can support.
Great. Anyone having a question? No one who thinks about doing a data request? So I don't see any hands or questions. Apologies for interrupting you, Sophie. So please
Mhm.
share some insights on Cienzano with us.
Yeah, okay. Okay, yeah, just
Yeah, the second
yeah.
part.
So what is the why data governance at Cienzano? So I don't know if you know Cienzano a little bit. The vision of Cienzano is that we are a key player in human and animal health. We have the institute Cura Serva that was joined to the WIF at the time. So they made together Cienzano. So it's about animal health as well, thanks to the excellence of our scientific research, high-level services, and integration of interaction between human, animal, and their environment. So it's really health. Cienzano is a One Health Institute. We try to bring together interdisciplinary approaches, scientific excellence, and innovation, and work with our partners. Now, the mission is human and animal health policies from a One Health perspective, and by making use of our expertise, by providing high quality scientific advice, collecting, analyzing, making health data available, collaborating with external partners, and liaise with other actors in Belgium. Um, but initially, our organization had 5 big scientific directorates who had a focus on a specific content topic. So, infectious diseases, biological exposure, chemical exposure, animal health, and then epidemiology and public health. And they all have this very common asset, of course, data, which is governed in the different directorates in their own way. So um, we thought it was a useful idea to really make data governance a big expertise area of Cienzano, and then to be able to push even more this whole idea of One Health, because you bring together not only the data, you reinforce expertise on lots of disciplines together in the one institute, in the One Health institution, and with being data driven, you can even more perhaps include the environmental data that affects health from a third dimension. So this is the whole idea, and then we have a lot of domains of expertise, and like I say, biological, quality, infectious, chemical, physical data. Now, health systems and crisis. We also are in charge of health risk identification and prevention, and assessing the status and evolution of health and healthcare. And so data governance was born 2021, and I started at Cienzano then because I developed this data strategy from this data maturity analysis, We published it, the data strategy, and it was followed by an implementation plan in 2022. And then data governance became a strategic priority of Cienzano in the management plan of 2023-2029. And so the 1st of April, a new scientific directorate was formed. And the idea is a little bit similar to what you heard from the HTA story, of course, because the HTA is the overarching organization, and the founding fathers of the HTA is Cienzano, Fach, KCE, RISIF, and Volksgezondheid. So Cienzano is one of those 5 organizations in the HTA on the picture. But again, Cienzano itself has a lot of data, like all of these other organizations, maybe except for KCE. So we want to increase the richness and the spread of the data that holds information about health. Sorry, there's an increasing amount of spread and richness of health data. There are new emerging data technologies. There's a need to collaborate between regional partners and reuse of data. We have to handle data in an ethical and secure way, and we have to improve surveillance and research and policy making. So these are all drivers for installing a data governance directorate, and some of the other momentums. Part of the driving forces are the European Health Data Space, of course. The HTA came at the same time. The FAIR data principles that are a big principle across the health data ecosystem, an exchanging landscape in terms of big data and artificial intelligence. And people tell me that this will have a huge impact on the health sector, artificial intelligence. There is the mission and vision of Cienzano, and the data management has become a strategic objective for Cienzano. And then there is the recommendations of a big report of the Rekenhof, which will be all incorporated in the operational plan of the data governance, the scientific directorate. So a lot of driving forces. And so what will be focused on? The scientific directorate will focus on data governance, so increasing governance around data with a strong focus on who's in charge of the data, the data stewardships, ethical and legal issues, having frameworks around data, and who is entitled to access when, for which data can be used for what, and all this is not governed. We will strengthen data collection and management, so making data fair in Cienzano, so findable, accessible, interoperable, reusable. We will increase the quality and the validity of the data and the methodologies. So also check better quality and methodology of data. We will improve data reuse and valorization, so contribute to the mission and vision of the European Health Data Space and the Health Data Agency by providing a trustworthy and efficient setup for the reuse of health data. We will improve also needs in terms of future infrastructure. Health data, the platform, is also part of this scientific directorate. So we are already, of course, having a lot of expertise in building registers and making data available. And then there is the data literacy and innovation, which is increasing data literacy and horizon scanning, researching, and promoting innovative data and analytical methods in data science. So that's the story, the plan for the data governance, scientific directorate. But of course, this is not entirely new to Cienzano. There's a lot of expertise on each of those levels and topics in Cienzano, but they were all sitting everywhere. And they were also not, of course, working in their own scientific directorate on their own topic fields. So we want to kind of make it more generically available across Cienzano. So that's the scientific directorate.
This is all very interesting, Sophie. Thank you for sharing. I think Julie has a question for you.
Yes, thank you very much, Sophie. It was very enlightening. Very concretely, if a company is interested to contact you, is there a SPOC, like a person of contact, or do they have to go to the website? That's my first question. And my second question is, let's say I'm a company and I have health-related data. I work with hospitals and I have nurse-related data, let's say.
Yeah.
How can we work together?
Right, that's a very good question. So the first question is, there is a general email address for the HTA. And so if it's, I presume you're talking about the Health Data Agency. So there's a general
Yes.
email address, info@HDA. You have to look on the website. I think it's info@hda.belgium.be. You have to look. I don't know it by heart completely. Of course, Kathleen Janssens is the leading official, but I think it's much better to go via the general email and that you get a reply there. There's somebody sitting behind this email to reply to you, so it's not uh, uh, somewhere where you end up not getting any contact. So that's the contact. There are, of course, specific persons looking after specific things. There are specific persons looking after communication, after data requests, after. But in general, I think these are also, and that's part of the issue with the Health Data Agency for the moment. They're all consultants, so they will be replaced by staff. So it's not the idea then to start emailing personnel, these consultants. Then the second question is indeed, so if you are a party and you have data and you are interested in making it available or joining the HTA in order to then also get access to data where you could perhaps link with other data, then you can onboard the HTA. So there's an onboarding process where you can actually, with someone who's in charge of this process will tell you, okay, what are your characteristics? How does your organization work? How is the data? And you can onboard the data onto the HDA. That doesn't mean that you give the data into a data warehouse because there's no data warehouse, but they are then listing the data you have. They will capture the characteristics of the data. And then you kind of say, okay, I agree to making my data available if it's possible under anonymized conditions. And you can also see on the metadata catalog of the HE if there are interesting links to be made for research. And that's the whole idea. So they are currently have onboarded, of course, the 5 founding organizations, but they also have onboarded, I think so far, IMA, Cancer Register, Stadbel. They are in the process of onboarding these organizations. So that's the idea of other organizations, as many as possible, who have data, so that your data is then visible on the metadata catalog, and you can also see what's there for you of interest. Yeah. Yeah, it's really like a coordinating, facilitating organ that brings the data. It tells you where it sits, what it looks like. It's like for the whole of Belgium, because at the
Okay.
moment people had to go and search everywhere on their own initiative. So you had, yeah.
And if I may, is there a call to action to the companies who are listening or are members with data or wanting to use data? Do you have like a big message to them?
Well, I guess the website of the HDA, the communications we have sent out, the symposium that was there on the 17th of January, that is actually saying, okay, the HDA is there. You can onboard, you can join us, you can do your data maturity analysis through us, you can put in data requests. That is the whole goal of the HDA. So anyone who is interested in research for secondary use of data, that means you reuse data that were initially collected for other purposes. You reuse that data to do research, to improve public health, to improve efficiency of the healthcare sector. Then that's where the HTA's goal is. And so any organization that is interested in research on these areas can join and onboard the HTA and then look at what kind of data is there out there for you. So indeed, the call is continuous. Yeah.
Excellent.
Yeah.
Thank you.
Yes, the website is very clear and very
Mhm.
extensive. You immediately see, you can go into the catalog. You can
Mhm.
there's a procedure for the data request. For the data catalog, it also refers you to the academy, so that's really great. So you were talking about the onboarding. You already onboarded, or the HDA already onboarded the founding partners, and it's currently ongoing with some other kind of federal institutions or organizations. Um, what is there a plan to onboard other parties, meaning like commercial parties or hospitals, or is it really like an you await the partners to come to the HDA?
No, no, no,
What is the
no.
plan there? Yeah.
No, 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 no. Waiting is an endless waiting game. Eh? No, no. We are pro. I think the HTA will have to. It's not down to me to decide, but the idea is to approach, of course, to make. Actually, the idea is to have the complete inventory of all the health data in Belgium available. It's not a data warehouse, so we're not asking for people to give the data to sit in the HTA. We just need to know where sits which data, and including hospital data, including pharma data, because the HTA doesn't make does include private partnerships, and so partners. So it's not exclusive for private partners, but it needs to know. The whole idea is to know the inventory of all the existing health data, to valorize it and make value out of health data. That's the first thing you need to know, is where sits which data. Mm. And that's including hospitals, including private pharma. The pharma is also part of our governing bodies, governing committee. So there's no, it's not just public. Eh? No. Did you assess the hubs? Did you assess the hubs? Can you explain a little bit, Frederik? There was one question by Frederik.
Yeah, but the hubs, yeah, you know, the primary e-health architecture in Belgium with
Yeah,
the hubs connect the hospitals and the vaults hold data from the first line.
yeah.
Yeah, so probably you did not assess the hubs, but the hubs have hospital data. So I would assume that uh, HDA is already in contact with some hospitals and looks into inventorizing the hospital data, right, Sophie? As this is
I don't know
quite
if that happens
important.
at the moment. I don't think it happens at the moment. The thing is, I think for the hospitals, well, first of all, it's primary use in the first instance. What they and then ultimately the data will have to become anonymized, pseudonymized in order to allow research. The hospitals have their own plans to do this as well, and to have a secure processing environment for allowing research in first instance with their own for their own research purposes. Um, the hospitals we took when I left, we took to the hospitals more in function of the idea of to create a secure processing environment for the hospitals, so that there is a I said that there will be different types of health data access bodies, and there are also having to be health data access bodies in Belgium, several, who are secure processing environments, meaning you bring the data there in order to process and analyze it and to really do the research. And so for Belgium, the thought is to have at least one for Brussels, Flanders, Wallonia, then maybe a whole big processing environment, secure processing environment for hospital data. But that needs to be still decided, which secure processing environments there will be for Belgium. Secure processing environment is again another role of a health data access body. It's a specific role. And there we look at the hospitals, but for the hospitals, we have the minimal clinical, the minimal minimale ziekenhuisgegevens. They are sitting at the FOT, the Ministry of Public Health. So they are included in the metadata catalog, of course. Then for other hospital data, I don't know. I don't know to which extent they are. They will have to be inventorized at some point, but for the moment, the discussions with the hospitals was more around these. Secure processing environments. On top of that, they have received now money from the ministry for these data capabilities to increase the quality of the data for primary use. So that's also something that I said many times. All the money and the energy that now goes into improving the data through these data capabilities projects for primary use, somebody should be watching there that what they do will be enough to allow secondary use so that you don't need to reinvest another layer of money to then allow secondary use. So that the data at this level for primary use is standardized enough and organized in such a way that it can be immediately reused for secondary use, that you don't have to do another investment to make the data ready for secondary use. But this is something I don't know. I was asked if health data can do it, this monitoring of these data capabilities projects. That we have not yet finalized the discussion around that, but my fear is that if we would have this money used to improve the quality for primary use, and we don't keep in our minds that one day this data has to be reused for secondary use, that we need to take care that all we do is making sure that this will be possible later and not just focus on the quality of the data for the primary use purpose. Do you understand what I'm saying? Yeah, so this is why I'm hoping that yeah, Karen.
Yeah, hi, Sophie. Thank you for the insightful presentation and all the explanations given. So I'm Karen Rix from Agoris. I don't know if you know it, consultancy and solutions company, including in life sciences. How can we support you in data reviewing and bioinformatics, etc., with the activities you're doing?
I don't know. So I don't know exactly what you're offering. So I don't know exactly what the
A medical
connections.
data reviewer, a bioinformatician. I saw those on your website, and now that I'm hearing you explaining all that, how can we collaborate together so we can make it a success both sides?
Yes, but perhaps we need to talk then in detail on what
Okay,
is it that exactly you can offer, what we do. I mean,
okay,
I
great. I'll be
yeah.
happy to do so.
Uh-huh.
Maybe we can reconnect after the meeting.
Mm-hmm.
Great, thank you.
When you talk about the primary use of data and the structurization of primary use, Sophie, I think there is definitely need for a discussion with HL7 Belgium and this ecosystem, because you know that this organization plays a role in the structuring of the data, right? But that is another point. And I think it's I have the same belief that we have to start as from the beginning for primary use with all the different objectives in mind, but there is still a long way to go. I have one final question. As you said that the founding partners have been already cataloged, or the data of the final partners, or for the data of the founding partners have been cataloged, right? That
Not
includes
completely yet, but yeah, it's yeah, they're almost there.
it's ongoing. Does
Yeah.
that include all the Cienzano data as well?
We're working on it. So we're working on it that it gets. I'm working on it now from data governance. So from my directorate is now take over this. Well, the HDA started it, but it's a long exercise. So we will from data governance. I have one chief data officer now. She's really looking after this inventory now. That's it's a huge search and dig and and talk to people. So yeah, but we're
Yeah,
almost there.
I imagine because it's a mass of data, right?
Yeah, well, it's okay. I mean, it's still not petadata, petabytes, so it's okay. But it's not huge in size, I think, but it's mainly very diverse.
Yeah,
So it's
that's what I
lots of
meant. Yeah.
different. Yeah, exactly. So that makes it complicated. But yeah. Mm,
Uh, it was very interesting,
mm.
Sophie, your presentation. Thank you so much. We don't have any questions anymore, so we will not longer take up your time. Good luck
Okay.
with all your endeavors
Yeah.
in both organizations.
Yeah.
Uh, and don't hesitate to reach out to us if we can help you in one way. And we will definitely promote the HGA and its
yeah.
services.
That's good. That's good. Okay. Thanks. No problem. Bye bye.
Thank you. Have a
Bye
good day.
bye.
Bye bye.
Thank you.